This is definitely another episode for the girls. And then also send this to any man in your life who has ever called you cranky, moody, emotional, anything like that during that specific phase of your cycle when you're having those PMS symptoms. We're, of course, going to cover PMS today, the science behind it, but then also just the various emotional differences we have in regards to our menstrual cycle and hormonal regulation, mental health, motivation, attractiveness, happiness, like all of these things are tied to our cycles. And so we're going to get into that today. I am your host, Dr. Kelsey Vick, a board certified orthopedic doctor of physical therapy and a pelvic floor physical therapist, the owner of the Ella Wellness Sisterhood. And this is one that I have just been super excited to dive into. If you've missed the first few episodes in our menstrual cycle series, we'll cover some of the basics today as far as like the science and the actual cycle component of it and the hormonal different hormones that are involved in different phases, but we're not going to dive in too deep. If you want to go listen to Menstrual Cycle 101, and then we also did Cycle Syncing Unlocked, those are episodes 19 and 20, and they give a sort of nice foundation for what we'll talk about today. And I love diving into all of this, but it's such a complex topic that I think it's best that we split it up into all of these different components. So episode 19 was more of the anatomy and physiology, and then episode 20 was more about cycle syncing and how we can sort of optimize the different phases of our cycle and how we're feeling in our cycle, especially in regards to workouts. So if you missed those, I highly recommend those. And the other thing that I was thinking of when I was like thinking about this episode was the last song, the movie The Last Song. If y'all ever, I think it's in the book too, but if y'all ever read the book or watched the movie, it's a Nicholas Sparks. It had Miley Cyrus in it. It is like one of my favorite movies, if that gives you any indication as to who I am. But do y'all remember when the like little brother was like, she's experiencing PMS, and the dad was like, what is PMS? She goes, come on, Dad, we know about this. It's pissed at men syndrome. So that's what I thought about when I was sort of like coming up with the introduction and title for this, but it just kept coming to mind, like pissed at men syndrome. And I thought that was like the most clever line when, I don't know how long ago that movie came out, but I just thought it was so funny and so applicable to today. So send this, again, this is a great episode for just validation of our own feelings, of our own responses during certain phases of the month, because I definitely know that there are certain phases where I do have more of an emotional response, or I do get a little bit more cranky or moody, or I start to sense certain things in a negative way when they weren't meant in a negative way. So I know that this is not a like unique experience for any of us. Like, it is very normal, and we'll dive into the science why, but it's definitely also validating to know that part of the time, and something that I talked to my therapist about, is like anytime I'm in my like later half of my cycle and I experience this sort of like negative emotion, sometimes I just tell myself, and it's helped to just like ride the wave, because I know that the like pot of gold at the end of the rainbow is coming. And I think I've used that example before, but it is nice to have this awareness of what's actually going on physiologically within my body, and knowing why my mindset is geared more in this way compared to more like motivation or positive thoughts or whatever, especially in that later half of my cycle. And so I picture it as just like riding the wave, especially if I'm just extra tearful or I'm just extra emotional around a certain topic that I might not normally be as emotional about. I just got to ride the wave. And so I feel like, I hope that's what you take from this today, is like, okay, this is actually what's happening within my body. This is why I might be responding in the way that I am. And this is how I can use this knowledge to sort of help me be more mindful of how I'm responding to things, and knowing that it's within my body and it is in my control, but it's also a little bit happening under the surface, where if we're able to be more mindful of and know that our bodies and our brains and our minds and our hormones are shifted more positively or negatively in one phase of the cycle compared to the other, we might be able to like take a pause and then just reflect on how we're supposed to respond, especially in a emotional or like traumatic situation. So I hope this helps with that, because as soon as I started diving deep into the science for my own body, I started to realize and be more mindful of my own actions, and also give myself a little grace for when I am feeling moody and just need to like ride the waves, right? So a little bit of an update. I know y'all are sick of me saying this, so I'll keep it short, but our summer shorty workout series is going on with the Ella Wellness Sisterhood, completely free, 4 weeks worth of workouts, 10 to 20 minute workouts. Pilates, strength, lower body, upper body, cardio, like all of the mix is in this 4-week program, completely free. I'll leave the link to sign up below, but it is built for at-home workouts, those short on travel or short on time, traveling over the holidays, or just wanting like quick workouts as sort of go-tos in order to maintain and hopefully improve your overall like health and wellness and help you reach those health and wellness goals you have set for yourself. So we'll get into it. We're going to start off with, again, I pulled, and I'll link the research articles, but I pulled some research for this one just so I can have the right words and actually know what has been researched, because there's a lot, like we can lump anxiety and fear and all of these things into one, but they're really different. And we have the tendency to sort of group negativity and positivity, negative emotions, positive emotions, less desirable emotions, more desirable emotions, all in groups. But I wanted to have the right words in relation to the actual research and the actual proof for you guys. That way I'm just not spouting out information that's like, we feel bad, so that's what our body is primed towards, is these bad feelings, whatever. There is actually science and physiological processes that surround the various phases in our cycle and how we regulate our emotions and our overall mental health. So speaking of emotional regulation, I feel like overall we'll start off with more of the negative. Like this first part might just seem like, oh my gosh, we are doomed, especially in that luteal phase of our cycle. But I promise there is like better stuff coming, better, like again, the pot of gold at the end of the rainbow. There is more positive things coming. So as a reminder, we have different phases, and we have different phases based on what part of our reproductive system we're talking about. So we have the follicular phase, then we have ovulation, then we have the luteal phase. And that's sort of the broad way that we can describe the phases, and that's what I'll use today. But we also have what happens at an endometrial level. So we have the proliferative phase, the secretory phase, and so you might hear these different sort of phases thrown around, and that's why I have the blog post for it and then the menstrual cycle 101 episode for it, so that we can describe things. But in regards to today, it's easy to break it into sort of like 3 cycles. So we'll have the follicular phase, which is said to be about days like 1 through 14. Day 14 is usually ovulation plus or minus 3 days. And then that later half of the cycle will be our luteal phase. And again, that's assuming a 28-day cycle. Normal's 21 to 35, so it could fall within a lot of those like various ranges, but that's kind of the terminology we'll use today. We also have hormonal secretions, different hormonal secretions that happen in each of those phases. And so in general, during that follicular phase, that first part, that's when estrogen starts to increase. And during that second part of our phase, that's when progesterone starts to increase. And then towards our period, that's when all the hormones start to decrease. So there's fluctuations within both, but if you can think of the follicular phase, days 1 through 14, first half of our cycle, estrogen dominant, and then the later half of our phase, the luteal phase, from like, again, that back half after ovulation, as the more progesterone dominant phase. And so that'll help get the gist and get more broad categories for what we'll talk about today. So diving into emotional regulation, we'll primarily focus on the luteal phase. And this is, again, is the later half of our cycle, and where we have higher progesterone levels. And a lot of those higher progesterone levels are correlated with some of these findings that these researchers found in regards to emotional regulation. So in the luteal phase, we have impaired emotion recognition accuracy. So this, as far as a study can go, it can look like giving people sort of images or faces or experiences and describing them as sort of positive or negative, or more desirable or less desirable, or happy or sad or whatever. We can put these emotional words to it and see how a person, usually college 20, 30-year-old girl who has a normal menstrual cycle, responds to those images, experiences, descriptions, etc. So in this luteal phase, in general, we're shifted more on high alert. And so we sense neutral faces as being more sad or more angry. Like we have a shift more towards like less desirable or negative emotions, more so because we are on high alert. So we oftentimes are quick to judge faces, experiences, situations, all of that might be positive or might be neutral, but we might be more geared to view them as negative in our luteal cycle, or in the luteal phase of our cycle. We have more difficulty recognizing the true emotions of people or situations. And in life, I have like a little life example, and this was pretty recent, but I was on a group call with my sisters, and I feel like maybe my youngest sister said something and just kind of responded, and I read her tone as like so sassy. So I responded super short, and my other sister was just like, get her, get her, get her. Like, golly, Kels, that was kind of like a sharp response when she meant nothing by that, right? So that's one of those real life examples where I feel like our impaired emotional recognition accuracy can be in those situations where we perceive someone else's facial like nonverbal cues, their body language, their facial recognition response as more negative or more sassy, or like, oh my gosh, why are they judging me? You know, why are they looking at me like that? So we just have an impaired ability to be able to truly recognize what someone is trying to portray with their emotions or with the situation. We also have enhanced emotional memory, which this can sound good, but in the research, it actually presents itself as maybe something that we don't necessarily want. It means basically that intrusive thoughts come to us quicker in the luteal phase, especially when we're presented with like an emotional traumatic event. So if we experience something in the luteal phase that is traumatic or more emotional for us, intrusive thoughts will come on more quickly, and we'll have more recollections of those sort of intrusive things that we remember happening in the past, or intrusive flashbacks that we might have, real or, real flashbacks we've had, or false ones where they might not actually be real, but we have more of those intrusive thoughts in this phase. If the trauma takes place in the luteal phase, we are also more likely to recall this trauma later on. So again, yay for us, yay for the luteal phase, but we have, again, more intrusive thoughts in this phase that can come up, especially if we experience an emotional event or a traumatic event. And then we also, if we do experience a traumatic event in the luteal phase, we have an easier time flashing back to that event later on in our life, right? So with the increased progesterone levels that are in this phase, there's also an increased reactivity in our sort of fear-mediated parts of the brain. So our amygdala and our anterior cingulate cortex. Yay, again, I told y'all it would start off negative, but I promise we will get to the positive parts. So when progesterone was injected in the early follicular phase, when it's typically low. So again, early follicular, like follicular phase, think of estrogen dominance. Luteal phase, which is kind of what we're talking about now, is when progesterone is dominant. So when progesterone is injected in a typically not high progesterone part of our cycle, we experience and we see, based on brain studies, that we have that similar reactivity in the amygdala and in those fear-mediated parts of the brain. So this just goes to show that it is truly progesterone that is helping to mediate that, or at least the relationship between progesterone and estrogen at that time frame, that is causing that increased reactivity in our fear-mediated parts of the brain. So overall, higher levels of progesterone are not our favorite when it comes to our menstrual cycle, not necessarily a place where we're going to be like extra motivated or extra positive. Trust me, that'll come. I'm getting to that next. But it's important to understand that these hormonal influences, these hormonal fluctuations, do cause variations in our brain. So we have high levels of progesterone help cause increased amygdala reactivity and increased emotional memory. We also have increased intrusive thoughts, increased imprinting of traumatic events that happen in the luteal phase with an easier time to flash back to these events. And then we also have it harder to distinguish various emotions in people or places, experiences, situations, things like that. So yay, I told you we'd start off negative. It gets a lot more positive next. So this next study took a look at approach avoidance behaviors, which is basically motivation. So we want to approach advantages and avoid disadvantages. So they call it approach avoidance behaviors. So in approaching behaviors, that's what we sort of can think about as like increased motivation. We have a motivation, we want to approach rewards and we want to avoid harm. And so it's kind of confusing, but I'll try and sort of clear it up when I speak about the research. But they call it approach avoidance, but it's basically both are good. We want to approach like rewards and advantages and then avoid disadvantages and harm. So when looking at approach avoidance behaviors during the menstrual cycle, specifically in the mid and late follicular phases. So this is right before ovulation. So this is usually after our period. We have that mid follicular phase and then late follicular phase. So in the mid and late follicular phases, right before ovulation, we have a faster approach time to positive stimuli, meaning we have a quicker reaction to seeking advantages, which is a good thing, right? It means that when I'll do another episode on this, but for me personally, like in my business, if there is something that is motivating me towards a business goal, I will be much more likely and much more quicker to do this during my like early to mid to late follicular phase during this first part of my cycle compared to luteal phase. So I'll oftentimes schedule things that I know that I hesitate doing or struggle doing during this part of my cycle, so that because I know that my body will be geared towards that, right? My body will be primed to do that activity that I otherwise might be a little bit more fearful of in that luteal phase. We also are wired for a quicker response and more motivation to go after positive stimuli and then also implement the behaviors that follow it. So we have a quicker, positive stimuli, quicker response time between the stimuli and our response. And then we also have quicker processing of the behaviors needed to implement that direction that we want to go. And so it's all over just like a really good time for motivation and for desire and for approaching positive stimuli. And again, this phase is the one where we have higher estrogen levels. So estrogen secretion peaks during the late follicular phase, and it plays a role in dopamine release and synthesis, which is possibly why we might experience more pleasurable feelings and emotions during this phase that also could reinforce the reason that we are wanting to approach more positive stimuli. There was another study, and I thought this was just interesting, but when we were presented with expected and actual monetary rewards, it caused higher activation of the reward system, likely due to higher estrogen levels. So that study looked specifically at monetary rewards, which is interesting compared to just even intrinsic motivation. And then also in this mid to late follicular phase, when we were presented with a negative stimuli, we actually had poor recognition and longer response times in this phase, which is interesting. So negative stimuli we want to avoid, but our processing between that negative stimuli and our response in this mid to late follicular phase was actually longer, meaning maybe our body is wired more to search out and seek those positive stimuli and then respond quicker compared to actually responding quicker to those negative stimuli as well, right? So it's not this completely inverse relationship where we're also quick to respond to negative stimuli. In this phase, we're actually slower to respond to those negative stimuli and slower to respond and slower to acknowledge that they are a negative stimulus, which I thought was kind of interesting, knowing that in this phase, we might be a little bit more risk tolerant, right? We might have a negative stimuli and we might be like, that's not that bad, compared to our luteal phase where we were presented with that same negative stimuli, and we might be a little bit more risk averse with it. So just thinking about that in regards to even investments or business ventures or classes you want to take or goals you want to pursue, all of that too, where we might be getting fed sort of negative stimuli when it comes to those things, or no's even. When someone tells you no for anything or a failing grade on a test, you're like, oh, that's usually a pretty negative stimuli. But knowing that in this phase, we also have a longer response time to that negative stimuli and understanding maybe that negative stimuli we might sense is not as extreme as we do in our luteal phase, I think that's just interesting. So in general, higher estrogen in that mid to late follicular phase, we have a quicker response time towards positive stimuli and can better implement the behaviors associated with reaching that reward and approaching that reward compared to if we are presented with a negative stimuli. We have a longer time to recognize that it is a negative stimuli, and then also a longer sort of avoidance time to avoid that negative stimuli. So in the mid-luteal phase, so we've moved on to that second half of our cycle where progesterone is high compared to the late luteal phase. So we're, again, progesterone dominant. We have a faster avoidance of negative stimuli. So when people were presented with images of snakes, tigers, angry faces, we have a quicker ability to recognize that as negative and then a faster reaction time to avoid that negative stimuli. So again, another positive thing in the luteal phase, we're talking about a negative experience, but we have a quicker response time to avoid that negative experience, which I think is pretty cool. So we have shorter response time to threats, which is likely due to that progesterone. And so it's a great phase to avoid harms. And I guess sort of the evolutionary thought process behind this is I think it was in Menstrual Cycle 101, episode 19, that we covered our immune system is down during this phase. And that's likely because if we do want a successful pregnancy, during this phase is where that fetus is, we want less antibodies, less things attacking that fetus. So we start to suppress our immune response during this phase to have a healthy sort of pregnancy, if that's our goal, if that's what our body's going through. And so again, our immune response is sort of suppressed in this phase. And so that means that our brain is possibly having that redundant pathway to say, hey, our immune system is depressed because we want to optimize this sort of the growth and the maturity of this fetus, should that be where our body's at, which means we cannot be exposed to as many harmful things. And so we have a quicker response time to those negative stimuli, if that all sort of tracks. But it's such a cool way that our reproductive system might be like, okay, hey, this is what we're doing. We're trying to actually have a successful pregnancy. We need to suppress the immune system so that we're not attacking and sort of trying to eliminate this new growing baby inside of us. And because of that immune suppression, we need a backup plan. And so that's where we have this tendency towards quicker recognition of negative stimuli and then a quicker response time to avoid those negative stimuli. So the luteal phase also enhances the sensitivity of women to threatening stimulus in their environment, again, possibly due to protecting our own health, which also means that we have an increased sensitivity to infection and just like various like nauseous stimuli, which I thought was kind of cool. So overall, we start, happies and crappies. We started with a crappy. It's usually not fun to think about being more cranky and more sensitive and more irritable during that luteal phase, during when those PMS symptoms start to occur. But it is always great to have a shorter response time towards positive stimuli and then a quicker avoidance of negative stimuli. So I thought that was a super cool way to sort of dive into motivation, reward, and then also avoidance of negative stimuli that we might experience in our environment. So I hope you guys learned a little bit in this episode. Again, the next episode, we're going to go over how I structure just maybe even my whole routine, if you guys would be interested in that, but specifically how I structure sort of like cognitive tasks, things like business things that I have to do, conversations I have to have, patients that I have to interact with, like how I feel and how I sort of navigate my knowing what's going on emotionally and with my brain, and how I sort of structure my week, my month in order to accomplish certain tasks that I need to accomplish, and then also prioritize other things for my emotional, mental health, brain health, knowing the hormonal fluctuations and knowing the phase of my menstrual cycle that I'm in. So I'm coming up with that episode. I'm kind of writing it. I think it would be really, really cool to have sort of almost like a planner because I don't think anyone's ever really structured their weeks in this way, knowing, especially for women, knowing the hormonal fluctuations that we have and knowing that as soon as I found out that, oh, okay, I'm more motivated during this phase and I just have to ride the waves during my, PMSing sort of part of my phase, it really helped me just be more mindful of how I'm acting and how I need to structure my month to know that I'm going to feel the best when I'm extra motivated and when I want to work towards my goals, where in that back half of the phase, I might not feel as motivated. I might feel a little bit more down on myself. I might feel that sense of failure a little bit more. But knowing that's when I just have to kind of ride that wave until my increase in motivation levels. And so I think bringing awareness to that is important. And then also hopefully I can give a little bit of a case study on how I structure my month and weeks and all of that, knowing my hormonal fluctuations, and hoping that will help you in your life and how you want to structure different business things, school things, activities, relationships, visiting with friends, prioritizing alone time, whatever that might be. So I hope you learned a lot from this episode. I always enjoy doing these, especially the menstrual cycle ones, because I feel like, again, I've learned so much of my body, and I hope that you guys can see that we're sort of building, right? It's like you learn about the menstrual cycle first, anatomy, physiology. Then you can learn how to feel the best in your body with workouts and movements and all of that. And now we're adding on that emotional health later, where it's like, okay, yes, this is why PMS happens. This is why I might feel cranky during this phase of my cycle, but this is also why I might feel motivated during this other phase of my cycle. So I think learning about that's super cool, and it's really helped me give myself grace during certain phases of my cycle, especially in regards to my own emotional health. So again, I hope you guys learned a lot from this episode. Let me know if you guys have any episodes or things you want to learn about in regards to the menstrual cycle. And if you learned something from this, I hope just like message me, tell me. I would love to know, and I'd love to sort of tailor the upcoming episodes to know what you guys want to sort of answer questions that you guys might have, especially in regards to the menstrual cycle. So thank you guys again. Again, a reminder that the Summer Shorty series is going on, so I'll leave that link below if you wanted to sign out or sign up. It'll end at the end of August, so it is coming to a close. It will just be in the summer, but it's completely free, so join me when you can. And you can do all the workouts in 1 week if you want. You don't have to do it over 4 weeks, but they are all available for you guys if you want it. So thank you guys again for listening to this episode, and I'll see you guys again on the next Wellness Big Sis podcast.